Which DEA form is used to report the theft or significant loss of controlled substances? A. DEA Form 41. B. DEA Form 222. C. DEA Form 106. D. DEA Form 363. Answer, C. DEA Form 106 must be completed by the pharmacy to report any theft or significant loss of controlled substances to the DEA. It ensures proper documentation and investigation of the incident. What is the main purpose of a laminar airflow hood in a clean room? A. To maintain room temperature. B. To remove odors. C. To provide sterile air for compounding. D. To store hazardous drugs. Answer, C. Laminar airflow hoods filter air through HEPA filters to create a sterile environment, essential for aseptic compounding of sterile preparations. Which auxiliary label should be placed on a prescription for metronidazole? A. Avoid dairy products. B. Take on an empty stomach. C. Do not drink alcohol while taking this medication. D. May cause drowsiness. Answer, C. Metronidazole reacts with alcohol, causing nausea and vomiting, hence, a do not drink alcohol label is required. What is the controlled substance schedule for oxycodone? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer, B. Oxycodone is a Schedule 2 controlled substance due to its high potential for abuse and severe dependence risk. Which of the following is an antihypertensive medication? A. Lisinopril. B. Lorazepam. C. Levothyroxine. D. Lansoprazole. Answer, A. Lisinopril is an ACE inhibitor used to lower blood pressure and manage heart failure. What is the maximum number of refills allowed for a Schedule 3 controlled substance? A. 2. B. 3. C. 5. D. Unlimited. Answer, C. Schedule 3 and 4 drugs can be refilled up to 5 times within 6 months from the prescription date. What is the meaning of the abbreviation QID? A. Once daily. B. Twice daily. C. 3 times daily. D. 4 times daily. Answer, D. QID stands for quater in die, meaning 4 times a day in Latin. Which law requires counseling to be offered to patients receiving new prescriptions? A. Kefauver-Harris Amendment. B. Omnibus Budget Reconciliation Act, OBRA 90. C. Poison Prevention Packaging Act. D. Controlled Substances Act. Answer, B. OBRA 90 mandates pharmacists to offer counseling to Medicaid patients on new prescriptions, ensuring safe medication use. The Beyond Use Date, BUD, for a non-aqueous compounded preparation is A. 7 days. B. 14 days. C. 30 days. D. 6 months. Answer, D. According to USP less than 795, non-aqueous formulations should have a bud of no longer than 6 months or the earliest ingredient expiration date. Which dosage form releases medication over an extended period? A. Immediate release tablet. B. Enteric-coated tablet. C. Sustained release capsule. D. Sublingual tablet. Answer, C. Sustained release formulations provide a controlled release of medication, maintaining steady drug levels over time. What is the primary storage requirement for insulin? A. Store below freezing point. B. Store in a cool, dry place. C. Store in the refrigerator. D. Store at room temperature indefinitely. Answer, C. Insulin must be stored in the refrigerator, 36 to 46 degrees Fahrenheit, to preserve its potency until opened. Which of the following medications is classified as a benzodiazepine? A. Citalopram. B. Diazepam. C. Sertraline. D. Buspirone. Answer, B. Diazepam is a benzodiazepine used to treat anxiety, muscle spasms, and seizures. A pharmacy technician receives a prescription for amoxicillin 500 mg PO TID times 10 days. How many capsules are needed? A. 20. B. 30. C. 40. D. 10. Answer, B. TID times 10 days means 3 times daily for 10 days, 3 times 10 is equal to 30 capsules. What is the generic name for Zocor? A. Simvastatin. B. Atorvastatin. C. Rosuvastatin. D. Pravastatin. Answer, A. Zocor's generic is simvastatin, used to lower cholesterol and reduce cardiovascular risk. What is the correct route for administration of an ophthalmic medication? A. Oral. B. Eye. C. Ear. D. Nasal. Answer, B. Ophthalmic medications are formulated for application into the eyes. Which of the following must be included on a prescription label? A. Patient's height. B. Physician's license number. C. Directions for use. D. Pharmacist's initials. Answer, C. Clear directions are essential on all prescription labels to guide proper medication use. A prescription reads amoxicillin 250 mg per 5 ml, take 10 ml every 8 hours. How much drug is taken per dose? A. 250 mg. B. 400 mg. C. 500 mg. D. 1000 mg. Answer, C. Each 5 ml contains 250 mg, so 10 ml equals 500 mg per dose. Which of the following medications must be stored in the original container with a desiccant? A. Warfarin. B. Nitrostat. C. Metformin. D. Furosemide. Answer, B. Nitroglycerin, Nitrostat, tablets are moisture sensitive and must remain in their original container with a desiccant. Which of the following is a loop diuretic? A. Hydrochlorothiazide. B. Furosemide. C. Spironolactone. D. Lisinopril. Answer, B. Furosemide acts on the loop of Henle to promote diuresis and reduce fluid overload. The Red Book provides information on A. Drug pricing. B. Drug interactions. C. Therapeutic equivalence. D. Clinical guidelines. Answer, A. The Red Book lists current drug prices, helping pharmacies with reimbursement and cost evaluation. What is the purpose of a Class 2 recall? A. Serious health hazard or death. B. Temporary or reversible health effects. C. Labeling error only. D. No safety risk. Answer, B. Class 2 recalls involve products that may cause temporary health issues but are not likely to cause serious harm. What is the function of the parenteral route? A. Oral administration. B. Injection into the body. C. Topical absorption. D. Rectal insertion. Answer, B. Parenteral medications are administered via injection, bypassing the gastrointestinal tract. Which of the following requires a DEA Form 222 for ordering? A. Hydrocodone. B. Alprazolam. C. Oxycodone. D. Morphine. Answer, D. Schedule II drugs like morphine require DEA Form 222 for ordering and transfer. What is the primary purpose of a medication reconciliation? A. To prepare sterile compounds. B. To compare medications across transitions of care. C. To label prescriptions. D. To file insurance claims. Answer, B. Medication reconciliation ensures that a patient's medication list is accurate across care settings. The USP chapter governing sterile compounding is A. Less than 797. B. Less than 795. C. Less than 800. D. Less than 1206. Answer, A. USP less than 797 set standards for compounding sterile preparations to maintain patient safety. What is the brand name for clopidogrel? A. Plavix. B. Coumadin. C. Lipitor. D. Zithromax. Answer, A. Clopidogrel's brand name is Plavix, used as an antiplatelet to prevent stroke and heart attack. What is the correct temperature range for a freezer used in pharmacy storage? A. -25 degrees Celsius to -10 degrees Celsius. B. 2 degrees Celsius to 8 degrees Celsius. C. 8 degrees Celsius to 15 degrees Celsius. D. 15 degrees Celsius to 30 degrees Celsius. Answer, A. Freezer temperatures must be maintained between -25 degrees Celsius and -10 degrees Celsius per USP guidelines. What is a tall man lettering strategy used for? A. Improving drug pricing. B. Reducing lookalike/soundalike drug errors. C. Improving patient compliance. D. Simplifying drug labeling. Answer, B. Tall man lettering emphasizes parts of drug names to prevent confusion between similar drug names. Which of the following is an example of a high-alert medication? A. Ibuprofen. B. Potassium chloride injection. C. Loratadine. D. Amoxicillin. Answer, B. Potassium chloride injection is high risk and can cause fatal cardiac events if misused. Which federal agency enforces the Controlled Substances Act? A. FDA. B. DA. C. CDC. D. OSHA. Answer, B. The Drug Enforcement Administration, DEA, enforces laws regarding controlled substances. What is the generic name for Celebrex? A. Naproxen. B. Ibuprofen. C. Celecoxib. D. Etodolac. Answer, C. Celebrex's generic name is Celecoxib, a COX-2 inhibitor used for pain and inflammation. Which of the following routes of administration is the fastest? A. Oral. B. Subcutaneous. C. Intravenous. D. Intramuscular. Answer, C. Intravenous injection delivers medication directly into the bloodstream for immediate effect. Which law requires child-resistant packaging for most prescription drugs? A. OBRA 90. B. Poison Prevention Packaging Act. C. Food, Drug, and Cosmetic Act. D. HIPAA. Answer, B. The Poison Prevention Packaging Act mandates child-resistant containers to prevent accidental ingestion. Which of the following is a beta blocker? A. Amlodipine. B. Metoprolol. C. Lisinopril. D. Losartan. Answer, B. Metoprolol blocks beta receptors in the heart, reducing heart rate and blood pressure. What is the main purpose of a prescription hard copy file for Schedule II drugs? A. Insurance review. B. FDA inspection. C. DEA audit. D. HIPAA compliance. Answer, C. Schedule II prescriptions must be stored separately for DEA inspection and compliance checks. What is the generic name for Nexium? A. Esomeprazole. B. Omeprazole. C. Pantoprazole. D. Lansoprazole. Answer, A. Nexium's generic is esomeprazole, a proton pump inhibitor used to treat GERD. Which auxiliary label is appropriate for doxycycline? A. Take with milk. B. Avoid sunlight. C. May cause constipation. D. Take at bedtime. Answer, B. Doxycycline increases photosensitivity. Patients should avoid direct sunlight. Which organization assigns national drug codes, NDCs? A. DA. B. FDA. C. CDC. D. CMS. Answer, B. The FDA assigns NDCs to identify drug manufacturers, products, and package sizes. A patient asks about generic substitution. What should the technician do? A. Refuse to answer. B. Refer the patient to the pharmacist. C. Recommend a generic. D. Change the prescription. Answer, B. Only the pharmacist may counsel patients about therapeutic equivalence or substitution. The HIPAA privacy rule primarily protects A. Pricing information. B. Advertising practices. C. Patient health information. D. Pharmacy storage conditions. Answer, C. HIPAA ensures confidentiality and security of all patient health information, both written and electronic.